Hi, my fellow ruminators. Welcome back to another session, Rumination with Andrew. It's indeed a pleasure to be with you one more time on this channel. And I hope that you are having a fantastic day. And I am about to share with you an interesting article that I've just read also from the Politico newspaper. And it has to do with the spreading of viruses in China. They're talking about RSVs, COVID-19, among other respiratory illnesses that seem to be bedeviling that southeastern nation of China. Now, it seems to me that they are, you know, beating the trumpets, sounding the trumpets, I should say, beating the drums by sounding the trumpets, that children are the ones who are most affected by these virus illnesses. But let's go now and see what the Political newspaper has to say. Let me share that with you now. Now, the title of the article is 5 questions about the latest disease outbreak in China. And it says here, it's more likely the bill is coming due to China's prolonged COVID lockdown than a novel virus emerging. So they are actually blaming China for having an extended period of lockdowns. Now, if you're reading the literature outside of the establishment, that is not what the establishment has been saying. Doctors who are trying to do honest, objective, dispassionate research have suggested that the lockdown responses to COVID was not effective. It was not an efficacious strategy that they used. And we are witnessing a lot of serious consequences due to these lockdowns, particularly on our children, but even on adults. And as far as mental health is concerned, many people are suffering from severe mental illnesses, including our children. And some of the behaviors, the abnormal behaviors that we're seeing in schools today, the challenges that teachers have to face in the classroom, some of these consequences, of course, are as a result of the long delayed lockdowns that we experienced during 2020 and 2021. All right, so it's interesting to note that Political newspaper is suggesting that China might have an extended lockdown. But what would be a lockdown that is reasonable? Nobody can say that because the scientists, those who are not a part of the establishment, that is, are in total disagreement with lockdowns. What you should do, you should isolate, you should quarantine those who are sick, and definitely allow healthy people to go about their daily lives, right? Now, here, okay, let's begin with the article. The wave of respiratory diseases hitting China is more likely the return of seasonal illnesses or illness, the country suppressed with prolonged COVID lockdowns than another pandemic threat. All right, so it's suggesting here in the first paragraph that the country did extend its lockdowns. Now, what is a reasonable lockdown time frame? I don't think these so-called scientists have been able to tell us what would be a reasonable time to have lockdowns. Children are flooding hospitals now in the same way they did in the US a year ago, infectious disease experts told the Politico. China's getting hit now as virus season arrives because it maintained COVID lockdowns far longer than most other countries, ending them only after a public vote in January. It's interesting to note that the lockdown philosophy came from China, and the Western world embraced it when it came from that country. But now it seems to me that they are behaving. The Western scientists, the establishment, those who are part of the establishment are now blaming China for having an extended lockdown program. Now, lockdowns and other pandemic precautions protected people not only from COVID, but also from other highly infectious respiratory diseases that are more dangerous to kids, such as flu and RSV. Now, there is a lot packed into this, or into this paragraph, into these sentences here, right? Because they're suggesting here that the pandemic precautions, including lockdown, saved a lot of people. They protected, these lockdowns protected people not only from COVID, but from other respiratory diseases, right? Such as cold, the flu, and RSV. Now, that's interesting. Where's the evidence? They have not cited anything to suggest that is something true, just speculation. I don't think there is any verifiable scientific evidence to corroborate their assertions here. Many children have never previously encountered the viruses or bacteria that can cause illness and are particularly susceptible. But one of the things I'm seeing here right now is that children are the center of attention right now. So parents have got to be very, very careful and to be vigilant in terms of what these authorities are saying. Now, still last week's demand by the World Health Organization for information from China on reported clusters of pneumonia in children in northern China reminded the world of the start of the pandemic nearly 4 years ago and triggered anxiety that a new pathogen may again cause a global outbreak. China's health ministry said Sunday that flu and other lockdown viruses and bacteria are causing the surge, not a novel virus. So they're blaming lockdowns on the surge. Very, very interesting. Is this a new virus or immunity debt? That's the question being asked. The US saw a similar outbreak last year after ending formal pandemic precautions. Flu, COVID, and RSV peaked at the same time, a confluence dubbed the triple-demic. The term immunity debt gained traction to describe it, and China might now be paying back its debt on a delayed schedule, the result of maintaining COVID lockdowns longer than other countries. So they're blaming China, the lockdowns for having, for the spread of these infectious diseases now in China. That to me is interesting. So when it is in the interest of the Western countries to use lockdowns or to implement lockdowns, it is a good scientific, what should I say, mitigation principle, or whatever you want to call it, response to ensuring that children or people are protected from these infectious diseases. However, when it's not in their best interest, then it suggests to me that they are blaming, they will use that same weapon as a way to blame another person for implementing such a response. Now, the CDC has endorsed the view that avoiding infectious diseases for a prolonged period makes the population more susceptible when lockdowns, masking, social distancing and other precautions cease. So it seems here to me that they are now suggesting that these are going to be the standard infectious diseases response. If we have any global outbreaks of any viruses, we're going to have the same lockdowns, masking, and social distancing, which never worked, right? But I think even though none of these, responses have any scientific foundation, but they still continue to spread this sort of misinformation and disinformation, because that is exactly what they do. And they are telling us in no uncertain terms, very frankly, candidly, that they are in charge, and whatever the scientists say, irrespective of oppositions or being debunked by other scientists, by other fellow qualified scientists, you will, the population, the global population that is, have to follow the standard procedure that has been set by the scientific people who work for the government, who work for the establishment. Now let us see what Johns Hopkins University has to say A large portion of the population probably is lacking immunity and haven't gotten infected with a number of other pathogens. And what we're seeing now is a burst of all these people in 1 year are getting infected, said Andrew Pecos, an immunology professor at Johns Hopkins Bloomsburg School of Public Health. Now, the thing about it here, we understand that the Johns Hopkins University does work for the military industrial complex, so they will have to definitely voice the same, the diktats and the the rules that govern the medical scientific industrial complex. Because testing so far isn't showing a novel virus at play, the outbreak in China shouldn't pose concern to health officials in the US, experts say. Now, let's look at this paragraph here. Within China, the outbreak could be the beginning of a surge of respiratory infections because children are often the conduits of disease to their families. Now, this is interesting. What is he suggesting here? That children are the main carrier or the main carriers of disease or diseases to their families? That is interesting, right? That's interesting. So if a grandmother should die and she was infected by, some pathogen, it means therefore that it's a child that was the conduit that caused it. Interesting. Sometimes the surge of infections can really put a stress on your healthcare system. And so monitoring for if this moves out of the younger pediatric age groups into other age groups and how many cases are increasing on a weekly basis is really the critical thing right now, he said. So, this is what you call surveillance. So they will have to surveil your child to see whether or not the child is making anyone at home sick. So much to a free and democratic society, right? And if you think you're living in a free and democratic society, you've got to rethink. Because clearly, this does not sound to me, this sounds to me like an attack on young children, right? To make them feel guilty. And we saw that during COVID, that you cannot take them without being vaccinated or, without wearing a mask because they're going to kill grandma. What nonsense, right? And very soon, it's not in this article yet, but I'm sure very soon they will be pushing for vaccination, right? And vaccinations for many of these or some of these so-called, respiratory illnesses. And nobody's talking about how to build and to strengthen your immune system. When I say nobody, I mean nobody from the establishment, right? Because what they are about is political control, right? And financial growth, right? Financial profit. That is what they're all about. They're not about saving your life or your children's lives, right? And this is what we've got to understand. The more you read the newspapers and what is happening in the world, you have to reflect on the words of Christ. When he was giving the disciples in Matthew 24, the signs of the time and what they should expect. And he said, because iniquity shall abound, the love of many shall wax cold, right? And people will tell you some cold lies in a nice way and in a professional way. And many of us believe them because they look professional, they sound professional, they belong to professional organizations, they edit and they publish professional books and journals. And you believe them because they sound distinguished, not understanding that their motive is not to save your lives, but to either injure you or to kill you. And that is something very difficult to digest for most of us. And we don't care what history might have taught us. We think we're living in this advanced technological scientific society, and therefore people are civilized. But I want to tell you that we are indeed living in a barbaric society. Right? Survival of the fittest. And you've got to make sure that your mind is fit to understand the information war that is being thrust at us at this point in time. We are living in an age of information war. And it requires serious thinking and serious reflection, because you have to dig beneath the surface of what many of these, the editors and the newspapers are saying. And I'm not suggesting here that this writer of this article might not have had good intentions. He or she might have good intentions. But good intentions don't mean that you can't be hurt and can't be killed by good intentions. All right, so we have to look beyond good intentions. We have to look and see what is the real agenda. And this agenda is a serious agenda, because what I've seen here is that there is going to be a serious viral infection coming to the West. Not sure if it is this next year or when it will arrive. And that viral infection will affect children more than, adults. The last one we had did not seem to have affected the children as much as it did to adults. And now it seems that they're manufacturing one that will affect children. And they are prompting us. They're preparing our minds that, yeah, it's coming. They might not be saying it clearly, but you have to look beneath the surface. Now, we have here, babies born during the pandemic had limited exposure to RSV because of pandemic precautions. So they're saying now that, and from then, scientists have been saying that lockdowns are not good for children, that they should be outside. They should be playing with pathogens in the dirt, and they should be interacting with nature. Because it is some of these pathogens. I'm not saying that we should expose our children to, unsanitary places, but they must not be in a situation where they're not exposed to any pathogens. Because the more pathogens they are exposed to, it's the more their immune system will grow and will be strengthened against other pathogens. Of course, you have to give them nutritious food, exercise, right living, clean environment. But yeah, we can't protect our children from all diseases and all pathogens. Some of them, or most of them, if not all of them, they have to be exposed to, because it's the world we live. We're not living in a perfect world. And I can tell you, let me just say this to you very clearly. No human being, and I don't care how many degrees he wants to have, how many scientific degrees he has, can eradicate all diseases in the world. In fact, every year, and generations after generations, we're seeing the surfacing of more diseases. They say that, they will say that polio is not with us, and they have eradicated polio, and among other diseases, but we see a proliferation of others. So when one is eradicated, we have 10 more surfacing. What's the sense? What's the sense? And are we going to vaccinate our way out of all the new ones that are about to surface and that are surfacing? Is that logical? Um, what should the US do to be prepared for all these viral illnesses, respiratory diseases coming? Increase hospitals' surge capacity, especially for children, experts said. So we see that there is an agenda to for children, to hospitalize them. And I hope those of you who have children begin now to read about viral illnesses, make sure that you are prepared and that you educate yourselves in terms of what are the alternative forms of medicine, all right? Because you don't want to take your child to the hospital and then, the child life might have been saved. The child's life might have been saved if you had just used simple remedies, right? We tend to depend too much on this medical establishment, and we've got to stop it. We've got to let them know that we don't have to buy their products, but we have to inform ourselves, because if we don't, then we are forced to use what they give to us, right? Most children's hospitals in the US run at capacity even in good times to survive economically, said Dr. Peter Hotez. This guy is an interesting guy. The co-director of the Texas Children's Hospital Center for Vaccine Development. Dr. Michael Osterholm, the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, said he's seen cuts in healthcare capacity overall and even harsher downsizing of pediatric units. Nobody's reporting out rates of disease, he said. They just say clinics are overrun. But what does that mean? Is it 3% of people infected? Is it 10%? No one knows. No one knows. Now, can we trust the data from China? And this is what I found interesting, because can we trust the data from the United States? If you listened to many doctors, those, of course, who are not a part of the establishment, right? The Dr. Pierre Corres, right? The Dr. Peter McCullough, right? All of these doctors who are world-renowned doctors, they say all the time, even now, that you cannot trust the data coming from United States CDC and the Johns Hopkins. The scientific data is not accurate and is often hidden. Right? So it's interesting that they are questioning whether or not the data coming from China can be trusted. Right? Now, didn't they trust the data when China had the outbreak of COVID-19 in 2020 when it got here? Didn't they trust that data? Didn't they trust China in implementing the lockdown policies? So why are they deciding not now? Why are they deciding that they're going to question China's data? Why now? Is it because the war drums are being beaten right now and there might be drumming up a war between the US and China? Mm-hmm. We've got to ask these hard questions. We've got to look beyond what they're telling us about the disease, because this is much more than a virus or a disease. I always think the key is, to quote President Reagan, trust but verify. And I wonder if they understand that's what the independent scientists were doing, the people like Peter McCullough and the Pierre Corres, right? And all the other, doctors who did not agree with Dr. Fauci and all of the persons who formulated the COVID response in 2020, right? These doctors, that's what they have been saying. They were not trying to castigate, they were trying to besmirch and to undermine the institutional integrity of the United States scientific institutions. They weren't trying to do that when the whole virus situation started first. They were trying to assist and to share their expert knowledge. But when they tried to verify, and having verified, they realized that the information was incorrect. Most of the information, if not all of the information, and the advice that came from the CDC and the Johns Hopkins and the American academia and the worldwide scientific industrial complex, military, well, we can say that industrial complex right now. It's all about money making. It's a corporate entity, right? All of this, having verified, they understood that the information was incorrect, it was inaccurate. Lockdowns didn't work, masks were not effective, vaccines that they produced were not only not effective, but they were dangerous. Right? But nobody wants to listen. As far as the establishment doctors and scientists are concerned, the people that I have just referenced, they are conspiracy theorists. They're not professional doctors and the scientists. Besides reviewing information China releases, the US also has its own verification system, such as travel data, to make sure we are not seeing anything different, said Jia, who is also another interesting person, who is now the dean of the School of Public Health at Brown University. Right? These doctors are so connected that they can go and talk all sorts of nonsense, and then they get to be at some of the top elite universities around the world. Because that's how the system works, right? You're elevated if you can just follow the rules. Follow what we tell you. Don't think, don't verify, or allow them to verify for you. But you don't have the intellect to verify for yourself or for yourselves. Right? The situation in China is exactly what we have expected to see happen, said Osterholm. What we're seeing is not a new infectious agent, it's the old ones coming back. It's influenza, it's mycoplasma, it's adenovirus, and some COVID, said. Now, it's interesting. The entire article is based on casting aspersions on China and its approach to the pandemic, to COVID-19, suggesting that China expanded and extended its lockdown policies, which the Western world did too. Have we forgotten that they just asked us for 2 weeks of lockdown and then they extended it until probably, was it 2 years or 2.5 years? Some countries were under lockdown, maybe 2 years, right? Right? People's mental health, their economic health, their physical health, their spiritual health, being totally devastated. Right? The hundreds of thousands of businesses that were closed down because of that catastrophic, because you wanted to protect us from violence. And now we're seeing that children are the major targets of what lies ahead. So they claimed to have protected the adults in COVID-19. I don't think they did, but that's what they claim, and why argue with them, right? But having protected the older folks, right, while restricting the movements of younger children or young children, of children, it has resulted in in the fact that children are now facing the fact that their immune systems seem not to be fighting against normal pathogens that they would be able to fight against had there not been a lockdown policy. Right? So the very recommendations that they made, we're seeing that while they purport that they did spare the lives of older folks, but we're seeing now that young people's lives, particularly children, are now being impacted negatively. Is this the signs that we're proud of? Is this the signs that we should follow? I would like to ask these people in authority, but they are not going to listen because they have an agenda and they want to accomplish what is on that agenda. But my challenge to you today, I hope that you have your agenda, and your agenda should be to educate yourself and to take precautions that will save you and your family's lives. That is my suggestion to you in this rumination session. I hope you'll have a fantastic day, and I look forward to seeing you in another video. Best of luck. All the best to you. Bye.